The moment the scalpel slipped and carved a red line across his forearm, Orion Lanton barely flinched. "Ah, damn," he muttered, dropping the blade onto the sterile tray with a clatter. Blood welled up instantly, thick and vibrant against his pale skin. A chorus of high-pitched screams exploded behind him. Orion turned his head slowly. 12 alien students stood frozen, their large, reflective eyes wide in horror. A few clutched at their thoraxes or whatever passed for a chest in their species, while one had already collapsed on the floor, limbs twitching. Yalara, the class coordinator from the Department of Intercultural Surgical Exchange, looked moments away from shedding her own carapace. She made a quick flicking motion with her upper limb, tapping frantically at her translator. "He is injured. He is leaking biologic fluid. He is wounded," she shrieked, voice rising with each repetition. "I'm fine," Orion said, calmly peeling off his glove. "Just a shallow cut." Another set of screams, louder this time. One student ran straight into the storage cabinet, knocking over a tray of synthetic ligature. The clang echoed through the lab. Orion stepped back from the table, leaving the half-dissected sim creature in place, and walked to the sink. The gash stung as he rinsed it under cool water, but it wasn't deep. He'd had worse shaving in a moving shuttle. He grabbed a sterile towel and pressed it against the wound. "Can someone hand me the medkit?" Yalara stood frozen, her pale blue skin turning a worrying shade of green. You require emergency assistance." "No," Orion replied, setting the towel down and opening the kit himself. "What I need is gauze, antiseptic, and a suture needle." One of the students, a lanky Kintari named Vesh, peeked over the examination table. "You will seal the wound yourself." "That's the idea," Orion said, selecting the right needle. "I can't exactly wait in the infirmary line." He looked back toward the room. "Is everyone all right?" The students had gathered in a tight cluster near the far wall. One was still moaning softly, rocking back and forth. Vesh stepped forward uncertainly. "You are not alarmed?" "Well, I'm not thrilled," Orion said, threading the needle, "but I've done this before." He sat on a stool, rolled up his sleeve, and cleaned the cut with antiseptic. The sting made him wince. Yalara finally spoke again. "You were performing invasive suture. On yourself. In front of students. That's the best way to learn, isn't it?" Orion said. "Real situations." He began stitching, hands steady, jaw tight as he pulled the wound closed with practiced movements. Another student gagged audibly. "All right, if anyone needs to step out, that's fine," Orion said, not looking up. "But this is basic field medicine. If you're going to work with humans, you'll need to get used to blood." Vesh took another cautious step forward. "But your own blood. I'd prefer someone else's," Orion muttered, tying the last stitch. "But that's not really an option right now." He finished, wiped the area clean, and applied a dressing. His fingers trembled slightly, not from fear, but from adrenaline finally ebbing. He'd been lucky. Another inch and he might have hit a tendon. Yalara made a strange whirring noise in her throat. "You are functional." "Yeah, just sore." "I'll log the injury." The class remained silent, staring at him as if he were some ancient beast that had just devoured a god. Orion stood up, stretching his arm carefully. "All right, who's next with the dissection?" No one moved. Vesh cleared his throat. "You may have traumatized half the class. Better now than in the middle of a crisis," Orion said. That was only the first week. The Intergalactic Medical Exchange Program was only 3 years old, but it already had more cultural misunderstandings than the entire Galactic Assembly combined. Orion had been recruited as the human instructor for xenobiological trauma response, essentially teaching aliens how humans handled wounds, injuries, and emergencies. They were doing fine with theory. The problem was blood. Human bodies were, by galactic standards, horrifyingly wet. Most species in the program had evolved with thick internal membranes that sealed off injuries before any fluid could leak. Others had exoskeletons or regenerative gels. Humans, in contrast, bled like open hydrants. The second incident happened 5 days later, during a joint simulation with the Fraxel cohort. Orion supervised while Vesh and his partner, a silent creature named Maluan, assessed a simulated avalanche scenario. I would recommend immediate stabilization of the lower limb, Vesh said, pointing to the sim patient's twisted leg. Orion nodded. Good. Now splint it. Maluan activated the traction brace. The simulation kicked into high gear, emitting a crunching sound auditory realism. Orion didn't even blink. Maluan, however, let out a shrill tone and fell backward, limbs flailing. The sim patient began to bleed from the femur, red fluid pumping in imitation of a severed artery. Vesh froze. You can't panic, Orion said, stepping forward. You've got 13 seconds before this patient codes. What's the first step? There is fluid, Vesh stammered. Pressure. Now. Vesh reached for the wound with shaking hands, his face twitching with revulsion. Orion grabbed a sterile cloth and pressed it down. Like this. The fake blood pooled rapidly, soaking the cloth. Maluan is unresponsive, Vesh said, eyes darting. He'll come around. Focus. By the time the simulation ended, Orion's shirt was stained with red dye and half the class had left the room. Later that evening, Orion sat alone in the small staff lounge, his arms still sore beneath the bandage. He nursed a cup of tea and stared at the stars outside the wide viewport. A quiet voice interrupted. You do not feel fear. Orion turned. Vesh stood in the doorway, fidgeting with his translator. I do, Orion said. But fear doesn't help someone who's bleeding out. Vesh walked in slowly. We are not used to your kind of damage. It is visible. It spills. We don't like it either, Orion said. But we deal with it. He paused, then added, I had to stitch up my brother when we were kids. He fell off a bike onto glass. We were in the woods. No medical help for miles. You were trained. No. I used a fishing hook and dental floss. Vesh looked horrified. It wasn't ideal, Orion admitted. But it worked. That's the point. The alien sat down across from him, his long fingers twitching. You are different than we expected. Orion chuckled, sipping his tea. That's what everyone says. 2 weeks later, the students were better. No one screamed during the next simulation, though one did faint quietly. Vesh had improved the most. He still flinched at the sight of blood, but now he moved. He acted. He stopped the bleeding. Then came the real emergency. Orion was leading a workshop in the outdoor terrain sim where students practice wilderness triage. The simulated forest was dense and humid, filled with artificial scents and distant noises. Orion stepped over a mossy log, demonstrating how to assess a collapsed body in rough terrain. Always check for spinal injury first, then bleeding, then consciousness. He moved too fast. The terrain shifted. His foot caught. He fell hard. There was a sickening crack. Pain burst up his left leg like a firework. Ah! He rolled onto his side, gasping for breath. Yalara rushed forward. Instructor Orion, what has occurred? I think it's my tibia, he said through gritted teeth. Or fibula. Something snapped. Vesh dropped to his knees beside him. Should we call medevac? Not yet. Check for swelling. I need confirmation it's broken. His leg throbbed. He felt cold sweat on his brow. Vesh touched the leg gently. Discoloration. Swelling. Angle is incorrect. All right. Splint it. Immobilize the joint above and below. Yalara looked horrified. You are instructing. Through injury. I'm not letting this be a waste, Orion said. Now help me up. Over the next 20 minutes, the students worked together to stabilize his leg, lift him onto a stretcher, and safely transport him to the nearest med bay. By the time the medics took over, Orion was pale and shivering. You'll need scans, the medic said. Could be a compound fracture. No surgery today, but you're out for weeks. I figured, Orion muttered. Vesh stood nearby, watching with wide eyes. You did good, Orion managed, before darkness overtook him. Orion didn't remember the ride to the medbay, but he woke up in a reclining chair with his legs suspended in a clear gel cast and a pungent antiseptic haze hanging in the air. The room was dim and quiet, lit only by soft wall panels that pulsed faint green every few seconds. He reached for the call panel, missed it, and sighed. "Do not attempt to move your limb," said a voice near his shoulder. "Your species' bones are notoriously fragile under rotational stress." The medic, tall, translucent, with a crown of twitching feelers, hovered into view. Orion blinked at him, squinting through the fog in his head. "Fracture." "2," the medic confirmed. "Both bones in the lower limb. No displacement, but soft tissue trauma is extensive. You ruptured several vascular pathways. Recovery will require at least 9 rotation cycles." "Days?" "On your calendar, yes." Orion eased back into the chair. "I'll need a crutch." "You will need 2, the medic corrected him. "And assistance during vertical transitions." "Great," Orion muttered. "I've become a teaching aide." The door hissed open. Vesh stepped cautiously inside, arms full with a container he'd clearly borrowed from the campus nutrition labs. "I brought sustenance," he said, placing the box on the table beside Orion's bed. "Protein cubes, mineral broth, and a fermented root compound. They said it might be pleasantly numbing." "I'm terrified to try that last one," Orion said, eyeing the box. "But thanks." Vesh remained standing. "I reviewed the footage of the terrain incident," he said. "You did not lose consciousness immediately." "I was trying to count the stars," Orion said. "Kept ending up with different numbers." "You still gave instructions." "I didn't want you to panic." Vesh tilted his head, antennae curling inward. "I did not. I believe I was focused." "Glad to hear it. You did well." Vesh hesitated. "Maluan believes we should formally acknowledge your example. We are arranging a tribute. I'm not dead. It is more a symbolic gesture. A learning marker." Orion leaned back into the cushion. "Just don't name a procedure after me." "That's always a bad omen." Vesh slowly nodded. "Understood." He lingered near the door, then added, "You should know. The others have been asking questions. About your threshold for pain, your tolerance, your ability to function under injury. They do not understand it." "They don't need to understand it," Orion said. "They just need to be ready when it matters." Vesh tapped his fingers against his side. "I believe they wish to study it." Orion raised an eyebrow. "Study how?" "Your neurochemical responses. Physical stress indicators." "There is fascination." "Of course there is." Vesh finally turned to go but paused. "Would you consent to being observed during your recovery?" "I'd prefer not to be a zoo exhibit." "Noted. I will inform them." 3 days later, Orion was back in the classroom. He refused to teach from a hover chair, despite multiple recommendations and a very pointed warning from the medic. Instead, he limped in on 2 support frames, each one fitted with a narrow stabilizer pad that clicked softly against the floor with every step. The students went silent as he entered. He reached the front, leaned against the counter, and adjusted the holographic projector. "Today we're doing hemorrhage management. Controlled environment. No injuries this time. Hopefully." A collective rustle passed through the students. Yalara stood to one side, visibly less pale than before, but still keeping a bottle of restorative vapor within reach. "Each station has a synthetic limb model. You'll be using compression wraps and adhesive sealant. No simulated blood, just pressure and technique." The room relaxed slightly. Orion rolled up his sleeve. "I'll demonstrate on my arm." Again, no blood this time. He wrapped the band tightly around his forearm, then showed how to secure it with a looped fold and a locking tab. "You want enough pressure to stop arterial flow, but not so much you collapse the limb. Check for pulse reduction. If there's still pressure in the distal zone, tighten it." Vesh raised a hand. "What if the limb is already detached?" "Then you're not stopping blood flow," Orion said. You're packing the stump and praying. There was an uncomfortable pause. Humans are very casual about trauma. One of the newer students muttered. Casual doesn't mean careless, Orion said. It means we've seen worse and lived through it. You don't survive winter without learning how to tie off a leg in a snowstorm. Another student leaned in. What is snow? It's frozen water that falls from the sky and tries to kill you, Orion said. Now focus. Wrap the limb like it owes you money. They practiced for an hour. By the end, most had at least managed a competent seal, though the adhesive on one station had bonded two students together. Orion left them to untangle that themselves. Later that cycle, just after dusk, he limped into the research dome. The air was cool and dry, filled with the scent of sterilized glass and ozone. A low hum vibrated through the floor as the environmental stabilizers kept the temperature just above freezing. The dome was mostly empty, save for one large table covered in what looked like dissected fruit. Malyuan sat on a suspended pad near the far edge, examining the inside of an artificial lung sac. You're up late, Orion said, settling into the chair opposite. I was recalibrating the absorption ratios of your species' pulmonary structure, Malyuan replied without looking up. The data is inconsistent. Welcome to humanity. Malyuan finally turned. Your respiratory resilience is statistically improbable. You survive with compromised oxygen saturation longer than any other sapient species, even the aquatic ones. We do like breathing, Orion said, but we'll hold it if we have to. Malyuan tilted their head. What would cause your people to develop such a trait? Probably all the things trying to choke us, Orion said. Smoke, ash, pollen, fire. Bad habits. Fascinating. Malyuan reached under the table and produced a small device. I wish to test your lung capacity. Now, your injuries do not affect pulmonary function. I have adjusted for pain response dampening. Orion took the device. Fine, but if this ends with me passing out and you dissecting me, that would require a separate consent form. He exhaled into the sensor. The machine chirped and displayed a chaotic graph with a rotating color spectrum. Malyuan stared. That cannot be correct. Good or bad? Your output exceeded the baseline by 76%. Must be the broth Vesh brought me, Orion said. Either that or stubbornness. Malyuan leaned forward. You are not augmented? Nope. All natural. The alien sat back, their posture unreadable. I request permission to scan your cardiovascular system during induced strain. Define strain. A light jog. Perhaps elevated terrain. With my leg in a cast? I was told humans enjoy challenges. Orion laughed. You've been talking to Vesh again. Malyuan clicked in agreement. I'll consider it, Orion said, but only if you let me test your reflexes afterward. Malyuan hesitated. That may result in unpredictable outcomes. Exactly. They sat in silence, the hum of the dome growing louder as the temperature dropped another degree. Outside, a snow simulation began to drift across the external plating, tiny flakes skittering across the dome's curve. I don't suppose you'd ever want to visit Earth, Orion said. Malyuan considered. If I did, I would require constant supervision. We all do. At that, Malyuan's face twitched. It might have been amusement. Orion leaned back. You know, you're the first one who didn't flinch when I started bleeding. I do not possess a fear response, Malyuan said, but I do possess curiosity. And your species continues to challenge my understanding of survival. You're not the first to say that. I hope I will not be the last. They sat a while longer, surrounded by the quiet hum of machines and the whisper of synthetic snow. It was 4 days after Orion's release from the med bay when the campus emergency protocols were triggered for the first time in over 3 Earth years. The alert came during a routine anatomy lab. He had just finished adjusting the grip pressure on a pair of surgical tongs when the overhead lights flickered, dimmed to a pulsing gold, and a low siren buzzed through the walls, more of a vibration than a sound. Every student froze. Orion looked up, then turned toward Yalara. who was already tapping into the wall console with trembling digits. The readout confirmed it within seconds. Containment breach in the Xenobotanical Wing. Category 3. He set the tongs down. Anyone here allergic to pollen? Silence. Good. Vesh, Malyuan grabbed the mobile medkits. Yalara, seal this lab and keep the rest inside. I'm heading to the breach. You are not cleared for breach zones, Yalara said, voice tight. I've got clearance for medical triage. And 2 functioning arms. He pointed to his still healing leg. That just means I won't run into danger. I'll hobble. He waved Vesh and Malyuan after him and limped toward the corridor, crutches thudding rhythmically against the floor tiles as alien students parted in his wake, eyes wide. The Xenobotanical Wing was located 2 levels down and across the central atrium. They took the emergency maintenance lift, which juddered ominously on the descent. By the time the doors opened, the air was already tinged with something sharp, spicy, acidic, and faintly metallic. Malyuan adjusted a small filtration mask over their mandibles. This compound is not on file. Then it's either new, Orion said, or it's mutated. The hallway beyond was hazed with a faint yellow mist. At the far end, a containment door had buckled inward. Something had clearly forced its way out. Orion hobbled forward, breathing shallowly. Keep your masks sealed. Vesh, set up the portable diagnostic. Malyuan, scan for carbon organics. The diagnostic unit clicked to life with a soft hiss. A glowing panel unfolded, displaying a spatial scan of the immediate 30 meters. It showed for life forms 3 clumped together, 1 further down the hall, unmoving. Someone's down, Orion said. 10 meters ahead. Let's move. They reached the fallen figure in under 30 seconds. It was a campus technician, a young Zerali with iridescent skin and a vest half melted from chemical exposure. Their breathing was shallow, eyes unfocused. Pulse weak, Orion muttered, kneeling. He twisted the med kit open. Vesh, get the neutralizing spray. Malyuan, prep oxygen flow. The technician's skin was slick with sap-like residue already eating through parts of their outer membrane. Orion pulled out a sterile pad and began wiping around the wound. Chemical burn patterns spreading. We need to stop absorption. Vesh hesitated, holding the spray canister. I do not know the compound's base. Doesn't matter. We need to isolate it. Spray. Vesh did, and the mist hissed across the technician's skin, halting the spread of the corrosion. Malyuan affixed the oxygen nozzle, and the Zerali let out a weak, rasping cough. Stay with us, Orion said. You're going to be fine. The diagnostic bleeped again. New movement. Something was approaching from the far corridor. Malyuan peered at the readout. Carbon signature. Large. Not humanoid. Retreat, Orion said. We carry the tech back. Now. Vesh grabbed the technician's legs. Orion took the shoulders. They moved fast, covering the distance back to the lift in under 2 minutes. Whatever had emerged from the lab didn't follow. By the time they reached the upper level, the emergency crew had sealed the floor and initiated full decontamination procedures. The technician was transferred to the care of the campus biohazard team. Orion leaned against the wall, panting. His casted leg throbbed. You shouldn't have carried them, Vesh said. Your limb is still compromised. I'll live. You may have worsened your recovery. I wasn't going to leave them there. Vesh fell silent. Then he said, I believe you are driven by something we lack. Poor risk assessment? Obligation. Vesh looked down at his hands. To others. You'll develop it, Orion said, if you stay in emergency response long enough. Malyuan stood nearby, gaze fixed on the sealed corridor behind them. The creature was not hostile. You saw it. Briefly. It recoiled when we took the technician. It did not pursue. Maybe it knew we were helping, Orion said. Or maybe it's scared. Should we report that? You just did. Malyuan blinked. I will add it to the incident log. That evening, Orion returned to his quarters and collapsed onto the cot. He didn't even bother removing the cast brace. His leg burned with a dull ache that seemed to pulse in time with his heartbeat. An hour later, there was a soft chime. He opened the door to find Yalara standing there, unusually quiet. "You disobeyed protocol," she said. "Entered an active zone. You risked contamination. Someone needed help." "I know." She stepped inside, glancing around. "This room is too small for your recovery. It's what I've got." Yalara hesitated. "You may request temporary reassignment to the upper instructor suite. It has hydrotherapy access." "I'll think about it." She didn't move. After a moment, she said, "The technician will survive." "Good." 3 students have submitted requests for field emergency certification. Orion raised an eyebrow. "Voluntarily. They cited you as their inspiration." He leaned back against the wall. "Then it was worth the limp." Yalara flicked her antenna. "You confused them." "Good. Confusion leads to questions. Questions lead to growth." She looked at him for a long time. "You are not what we expected." "I know." She turned to leave, but paused at the doorway. "You should rest." "I'll pretend I didn't hear that." The door slid shut behind her. The next morning, Orion woke to find a message from Malyuan. It contained 5 words. "The creature has been relocated. No details. No alarm. Just resolution." He smiled faintly, then winced as his leg twinged again. He reached for his crutches, pulled himself up, and hobbled toward the hallway. There was still a full schedule of labs, and someone had to teach them how to find a pulse on a being with no bones. It was going to be a long day, but he'd take it, one limp at a time.